When aspirin was formulated to alleviate the pain related to headaches, little did we know that one day this over-the-counter headache medication would help in the prevention of heart attacks. Something similar is happening in the world of ophthalmology, with the discovery of one of the medical industry's more remarkable vision correction procedures that is returning sight to many people who are considered legally blind. Director of Ophthalmology Research at Cedars-Sinai Medical Center Cornea Genetic Eye Institute, Dr. Yaron Rabinowitz, whose research includes the genetics of keratoconus, a disease affecting the cornea, specializes in the cornea, refractive surgery, and hereditary eye diseases. This member of an elite group of ophthalmologists using the procedure for treating this condition tells us more.
Keratoconus is a thinning disorder of the cornea. As you know, the cornea is the window of the eye, and it refracts light coming into the eye, giving a picture on the retina. In keratoconus, the cornea thins over time. As it thins, the eye becomes longer, people become more nearsighted, and it causes distortion, producing irregular astigmatism, causing a distorted image over the eye. Now, this disease normally occurs in young people, normally in their teens, and progresses till about age 40. And most people can only be corrected with contact lenses. A certain percentage of these people, eventually the cornea thins to a point where the only way they can be corrected is with cornea transplants. In fact, keratoconus is the commonest cause of cornea transplants in the Western developed world. Keratoconus can have a significant effect on the patient's quality of life. As you know, they wear rigid contact lenses. These contact lenses can often be very uncomfortable. And patients may have a 14 to 16-hour workday and often only tolerate these lenses for 6 or 8 hours at a time. And often these lenses, because of the shape of the cornea, don't fit very well, so they often fall out. So there may be many times during the day where patients can't see really well. They're often very uncomfortable, tend to rub their eyes a lot. So patients with keratoconus often have a very disruptive lifestyle.
Originally developed for people suffering from myopia, more commonly known as nearsightedness, or as an alternative to laser surgery or wearing contact lenses or glasses, Intacs are prescription inserts which uniquely enhance the eye's natural vision system. Founder and director of the University of California San Diego Shiley Eye Center at UCSD, Dr. David Shanslin, who specializes in the procedure, explains.
Unlike other refractive surgical procedures, there are some distinct advantages to Intacs. The most important, of course, is that we're not removing any tissue. So when we add these elements to the cornea, should we ever remove them, for whatever reason, the cornea goes right back to its natural shape. This allows the patient various options for the future. As they get older, if their visual needs change, the Intacs can be removed, they go right back to the way they were. And that's a distinct advantage to patients. The second big feature is that the shape factor of the cornea is normalized by Intacs. We like to have corneal shapes that are aspheric in nature, like a good camera lens, and in order to optimize that, we want a certain shape, and that, of course, is maintained by Intacs, unlike the laser procedures, where that shape factor is altered in an abnormal fashion.
The first ophthalmologist to use Intacs for keratoconus in the United States, former director of the UCLA Laser Refractive Center at the Jules Stein Eye Institute, and founder of the Boxer-Walkler Vision Institute in Beverly Hills, California, Dr. Brian Boxer-Walkler, a pioneer and leader in the forefront of refractive surgery, explains this simple outpatient procedure.
There was a major factor that led me to pioneer the use of Intacs for keratoconus in the United States, which were my patients. I've seen what patients have gone through. They've been very frustrated with their contact lenses, which they can't tolerate. And then the only other alternative was an invasive cornea transplant. And I was really looking for something that was ideal for patients between those two areas. And that was the Intacs procedure, and it's really borne out to become that procedure for people who are having trouble with contact lenses, and maybe not even having trouble with contacts. Maybe it's just even glasses. But they really are apprehensive about a transplant, and they're looking for something minimally invasive, and that's what Intacs are. Well, the Intacs procedure is a very easy procedure. We use numbing drops, so there's no pain at all, and it takes usually no more than 10 minutes to do for each eye, so it's very quick and easy. Patients are typically underwhelmed by it as I explain the process to them, and they really say, wow, I was underwhelming as you described it. There's a few steps to the process. We make a small little opening and we create a little channel underneath the surface of the cornea, and we slide the Intacs in, and that's pretty much it.
Well, I had just found out that I had keratoconus, and I was under the understanding I was going blind, and there was no chance except for a corneal transplant. And when I found out that this was being offered, it seemed like the last hope, the only hope, and it's wonderful. It's amazing. I can see my alarm clock without my contacts in. I can look at my daughter and see how beautiful she is and count her freckles. Before, I couldn't do that with even my contacts in. So it's special. It's very important.
Within the last 12 months, Mark Swanson, MD of Mexico, has made revisions to the procedure which are resulting in even better vision than the original method.
Before the Intacs, the options for keratoconus were eyeglasses, which sometimes doesn't work, contact lenses, and then after the contact lenses doesn't work, then we go to the cornea transplant, which is a major procedure. I decided to use Intacs on my keratoconus patients because their quality of life was very bad. And I cannot correct those patients with glasses or with contact lenses. And also, with the Intacs, I will try to stop the progression of the cone of the disease of this patient, and also gives these patients a better quality of life, better quality of vision.
To find out more about the benefits of Intacs, or to locate an ophthalmologist who specializes in this procedure, call toll-free 1-888-846-8227 or visit the website at www.getintacs.com.